Okay, so you're back for another deep dive with us. You're here because you want to really get this stuff right. And today we're tackling something that I know can be a little bit intimidating for some folks, and that's local anesthesia calculations in dentistry. But fear not, we are going to make this super clear, useful, and hopefully even a little bit fun. No stressing over calculators here.
Absolutely. We want to equip you to confidently administer local anesthesia safely, effectively every single day. And for this deep dive, we dove into a video lecture and a super detailed PDF document, both focused on, yeah, you guessed it, local anesthetic dosage in dentistry.
And we're not just going to regurgitate formulas at you. This is all about how to apply those core principles, right, to everyday practice. And we all know as dentists, as much as we love our patients, the word calculations, it doesn't always get us jumping for joy, right? But think of it this way. This is the foundation of keeping your patients safe and comfortable. We're talking about preventing overdoses, minimizing that annoying, prolonged numbness everyone hates, and above all, making sure we're steering clear of any of those systemic complications that can really throw a wrench in things.
Yeah, I mean, no one wants to deal with that, right?
Yeah.
So let's start with the most basic question.
Mm.
Why do we even bother calculating these things in the first place? Why not just, eyeball it? What do our sources say?
Yeah, the sources are really clear on this.
They are.
The whole point of those calculations boils down to, like you said, patient safety and making sure the treatment is actually effective. We want to know exactly how much anesthetic we're giving so we don't go over that maximum recommended dose. And no one wants to be numb for longer than they need to be.
No.
Right?
Yeah.
So we got to get that dosage right to keep our patients happy,
right,
and avoid any of those potential systemic issues, the toxicities we talked about, that can come with too much anesthetic.
Yeah.
So when we're thinking about these calculations, what are those must-haves? What info do we absolutely need before we even start crunching numbers?
Okay, so our sources, they lay out 3 key things you got to have no matter what. The first one is the maximum dose of that specific anesthetic, which is usually given in milligrams per kilogram of body weight, that milligram per kg. That's basically your safety limit based on the patient's size. Then, of course, you need their full medical history. That is super important. You got to know what you're dealing with, right? And last but not least, you need their weight, their exact weight in kilograms. Now, sometimes you might have to deal with conversions and different units, but for this deep dive, we're going to stick to the practical stuff, the stuff you're actually going to use every day in the chair.
Okay, so we've got those 3 must-haves. Now let's talk about the anesthetic itself. We see that concentration on the cartridge. But how do we actually figure out how much anesthetic, in milligrams we're giving to the patient?
Yeah, that's where things can get a little tricky, but there's a simple trick that our sources point out. That concentration on the cartridge, it's a percentage, right? And what's cool is that you can directly relate that percentage to the maximum safe dose, which we know is in milligrams per kilogram. So here's the trick. You take that percentage and multiply it by 10. Boom! That gives you the number of milligrams of anesthetic in each milliliter of solution. So for example, if you've got a 1% lidocaine solution, you multiply 1 by 10, and you get 10 milligrams of lidocaine for every milliliter of solution.
Mm-hmm.
Super easy, Rick.
I love a good shortcut. But those cartridges, they're not exactly one neat little milliliter, are they?
No, they're not.
I mean, we're usually working with something a little bit bigger.
The standard dental cartridge is 1.8 milliliters. Now, you might see some weird ones in exams or whatever, but for the most part, you're dealing with 1.8 milliliters. So to figure out how much anesthetic is actually in that whole cartridge, you just got to take your milligrams per milliliter and multiply by, 1.8. So for our 1% solution, we had 10 milligrams per ml times 1.8 milliliters. That means there are 18 milligrams of anesthetic in that whole cartridge.
18 milligrams for a 1% solution. Okay, got it. Now, what about the other common concentrations we use? I know we see 2% all the time, sometimes even higher.
Yeah, totally. For a 2% solution, same idea. 2 times 10 milligrams per ml times 1.8 milliliters. That gives you 36 milligrams of anesthetic per cartridge. If you're using something like 0.5%, it's 0.5 times 10 times 1.8, which works out to 9 milligrams. Then, of course, you've got 3%. That's 3 times 10 times 1.8, totaling 54 milligrams. And if you bump it up to 4%, you're looking at 4 times 10 times 1.8, a whopping 72 milligrams of anesthetic in that standard cartridge.
That is a lot to keep straight, but it's so helpful to have those numbers clear in our heads. Now, we also talked about the maximum dose per kilogram, and I know there are all sorts of different local anesthetics out there. So do those maximum doses change depending on which anesthetic we're using?
They absolutely do, and it's super important to know the differences. Luckily, our sources provide a really handy table that outlines those maximum recommended doses for all the common local anesthetics we use in dentistry. So, for both articaine and lidocaine, that maximum dose is 7 milligrams per kilogram. Mepivacaine is a little lower at 6.6 milligrams per kilogram, and that stays the same whether or not there's epinephrine in the mix. Then you've got prelocaine, which is a bit higher at 8 milligrams per kilogram. And finally, bupivacaine comes in with the lowest maximum recommended dose, just 2 milligrams per kilogram.
Those are definitely numbers we need to have memorized for sure. Now, one of the sources mentioned a really cool shortcut related to epinephrine, which is often added to our local anesthetics, right? Something about how it can actually simplify our calculations in a lot of cases.
Oh yeah, this is a huge time saver, especially when you're dealing with adults. You see, a lot of times you'll hit that maximum recommended dose for the epinephrine before you even get close to the max for the local anesthetic itself. Especially in adults, it's often the vasoconstrictor that's calling the shots, not the anesthetic.
Okay, that's good to know. But what about those times when we have a patient who's, let's say, on the larger side? Is there ever like a hard limit on the total amount of anesthetic, regardless of their weight?
You're right, there are definitely limits. That's where the concept of an absolute maximum dose comes in. So even if you do your calculations and the weight-based dose comes out super high, there's still a cap. For example, a commonly cited maximum for lidocaine is 500 milligrams. Doesn't matter how much the patient weighs, you're not going over that 500 milligram limit. It's kind of like a safety net, especially for those larger folks.
So thinking about all this, when do those weight-based calculations, those super precise ones, when do they really become crucial?
Our sources highlight this point. It's especially important when you're dealing with kids or anyone weighing under 66 kilograms, which is about 145 pounds. Because their bodies are smaller, their metabolism is different, you got to be extra careful with the dosage. You really need to do those individual calculations to make sure you're staying within safe limits for both the anesthetic and, of course, any vasoconstrictor that's in there, like epinephrine.
All right, let's talk a little bit more about epinephrine, that vasoconstrictor we keep mentioning. I know its concentration on the cartridge is expressed a lot differently than the local anesthetic, right? We're dealing with ratios instead of percentages.
Exactly. You'll see epinephrine expressed as a ratio, like 1 to 100,000, which can be a little confusing. But what you really need to know is how much actual epinephrine that translates to in the cartridge. And for that, it's often easiest to think about it in micrograms per standard 1.8 milliliter cartridge.
Okay, so what are some of those common amounts of epinephrine we're likely to see in a standard cartridge based on those ratios we use all the time?
All right, so let's break it down. If you've got a 1 to 50,000 epinephrine concentration, that means your standard 1.8 milliliter cartridge is packing 36 micrograms of epinephrine. If the ratio is 1 to 100,000, you're looking at 18 micrograms in that same cartridge. And for a 1 to 200,000 concentration, there'll be 9 micrograms of epinephrine in that 1.8 milliliter.
And it's important to remember that the bigger that second number in the ratio, the lower the actual concentration of epinephrine. So 1 to 50,000, that's way more potent than 1 to 200,000.
Yeah, exactly. It's an inverse relationship.
Now, we spent a good chunk of time talking numbers, but both of our sources really stressed that none of this matters if we don't have a solid grasp of our patient's medical history.
Oh, absolutely. That's like step one, the most important step. Medical history isn't just some formality. It can completely change how you approach local anesthesia. Sometimes what you learn from the patient's history will dictate your choice of anesthetic and dosage, even before you start doing any calculations.
Can you give us some examples of how a patient's medical history might lead us to make different decisions about which anesthetic to use or how much we can safely give?
Sure. Let's say you've got a healthy adult patient, over 66 kilos, no allergies, no major health issues. You're probably good to go with those general maximum dose tables we talked about. Use your clinical judgment, of course, but you might not need to whip out the calculator for every little procedure.
That makes a lot of sense, especially in those routine cases where we're not doing anything too crazy.
Right.
But what about when things are a bit more complicated? Like what if our patient has a heart condition?
Ugh. Yeah, heart patients. That's when you got to be super careful with epinephrine. Especially for folks with conditions like hypertension or heart disease, the amount of epinephrine becomes the main limiting factor. The sources give some clear guidelines for this. So if you're using a 1 to 100,000 epinephrine solution, the general recommendation is to stick to a maximum of 2 cartridges, for these patients. Now, if you go with a lower concentration, like 1 to 200,000, you can usually bump that up to 4 cartridges max. But if you're thinking about using a higher concentration, like 1 to 50,000, you probably want to limit it to just 1 cartridge, if you use it at all. And it's important to remember that the overall safe limit for epinephrine in these cardiac patients is usually 36 micrograms. That's why knowing how much epinephrine is in each cartridge is so important.
Those are some really solid guidelines to keep in mind. Now, what about allergies? How do those affect our choices when it comes to local anesthesia?
Oh, allergies are crucial. Got to be super aware of those. If a patient tells you they're allergic to sulfites, you got to avoid any anesthetic with a vasoconstrictor, like epinephrine. That's because they use bisulfite as a stabilizer in those solutions. So in those cases, no epinephrine whatsoever. You'd have to go with a plain local anesthetic if that's appropriate for what you're doing.
And we already talked about how important those precise weight-based calculations are for kids and anyone under 66 kilograms. Really got to pay attention to the details of those folks, right?
Absolutely. You can't just rely on the adult guidelines for them. You got to do that personalized calculation based on their weight and the specific maximum doses to make sure everything's safe.
Now, our sources also touched on a few other things, like certain types of allergies and other situations where we might need to be extra cautious or choose a different anesthetic altogether. Can we just quickly run through some of those key points?
Of course. So beyond those common allergies and heart issues, there are other things to keep in mind. If a patient has a confirmed allergy to a specific local anesthetic, like let's say lidocaine, you got to avoid anything else in that same class. There are 2 main classes, esters and amides. Esters usually have 1 I in their name, like procaine, and amides have 2 I's, like lidocaine. So if they're allergic to one, steer clear of the whole group. We already talked about bisulfite allergy, which means no vasoconstrictors whatsoever. Then there are those situations where it's not a hard no, but you got to be really careful or consider alternatives. Like if someone have a condition called atypical pseudocholinesterase, you want to avoid those ester-type anesthetics because they rely on that enzyme to be broken down. Or if there's a risk of methemoglobinemia, you got to be careful with prilocaine, especially high doses. Liver problems might mean lowering the dose for amide anesthetic since that's where they're metabolized. And if someone has kidney problems, you might need to adjust your approach for both amide and ester anesthetics. And of course, we already covered those cardiovascular issues and hyperthyroidism, where you got to be really conservative with the epinephrine.
Wow, that was a lot to cover. But it's so important to be aware of all these different factors. It's not just about the weight and the numbers. You really got to consider the whole patient, their medical history, everything.
Absolutely. It's about individualizing your approach, right?
Now, before we wrap things up, can you explain a little bit more about that limiting dose concept we mentioned earlier?
Sure. So when you're using an anesthetic with a vasoconstrictor like epinephrine, you've got 2 limits to think about. The maximum safe dose for the anesthetic itself, based on that milligrams per kilogram calculation, and the maximum safe dose for the vasoconstrictor, which often depends on the patient's medical history, like we talked about with those cardiac patients. The limiting dose is simply whichever of those 2 is lower. Whichever one you hit first, that's your absolute limit. You can't go over either of those thresholds.
Okay, that makes sense. And what about when we're trying to figure out how many cartridges that limiting dose translates to? Remember, our video source talked about some rounding rules to help us stay on the same side.
Oh, yeah, that's a great point. When you do those calculations, you always want to round down to the nearest half cartridge. It's just a good safety practice. So, for instance, if you come up with a maximum of, say, 5.3 or 5.4 cartridges, you'd round that down to 5 full cartridges. And if your calculation gives you 5.7, 5.8, or 5.9 cartridges, you'd go down to 5.5 cartridges. It's just an extra layer of safety for our patients.
Makes sense. And finally, I love that little pep talk in the video. They basically said, don't panic when it comes to these local anesthetic calculations. Why is that such an important message for us to keep in mind?
I think sometimes we get so caught up in the numbers and the formulas that we forget the bigger picture. A lot of times, those exam questions or even those quick calculations we do in the chair, they're not designed to trip us up with crazy math problems. They're really just testing our understanding of the basic concepts, those key maximum doses, and the crucial role of the patient's medical history. So if you take the time to really memorize those important numbers we talked about, like those maximum doses per kilogram, the epinephrine content in different cartridges, and those specific limits for certain conditions, you'll be in great shape. It's way more important to be calm, systematic, and focus on those core principles than to freak out over complex calculations in the moment.
So, to sum it all up, what are the absolute most important takeaways you want our listeners to remember and be able to apply in their practice?
Okay, so the key things are: Always, always know those maximum recommended doses for the different local anesthetics you're using. Never underestimate the importance of the patient's individual medical history and their weight in determining safe and effective dosages. And be super familiar with those practical guidelines, especially when it comes to vasoconstrictors like epinephrine. You got to know those limitations for certain patient groups, like those with heart problems.
It might seem like a lot to remember, but as we've heard from our expert, if you really focus on those underlying principles and the most common clinical scenarios, you'll be well on your way to mastering this crucial aspect of patient care.
Exactly. And once you really get comfortable with those core concepts and those key numbers, those calculations will start to feel a lot less scary. You'll be able to approach them with confidence and ensure your patients are getting the best and safest care possible.
And on that note, here's a little something to ponder as you continue your awesome work as dentists. We've talked a lot about those key calculations and guidelines, but think about this. Each patient is unique, right? They have their own physiology, their own health status, and those factors can really influence how they respond to local anesthesia. So beyond those core calculations, what other subtle nuances might be at play? How much you need to adjust your approach based on those individual patient factors and the specific demands of the procedure you're doing. It's all about that personalized touch, right? Food for thought. Thanks for diving deep with us.
My pleasure.
We'll catch you next time.